Dr. Morgentaler.
Dr. Brandon, how you doing?
I'm well. How are you?
I think it's time for another episode of the
Sex Doctors. I think so too.
Great. So what's on today?
Well, today I thought we'd talk about an article about premature ejaculation and medications that were used to help guys with it.
Premature ejaculation, otherwise known in the lingo as PE.
Yeah.
PE, not physical education, but premature ejaculation.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Right.
So this is a terribly disabling thing that happens to guys. They feel awful.
Yeah.
Very high percentages of men in the U.S. and around the world who suffer from this. Mm-hmm. Estimates somewhere around 20% of men. Not just young men, but throughout the age span too.
Yeah.
And the guys just feel like they're bad lovers. They feel like they're really they're not doing it right. They're embarrassing, humiliating. And
unfortunately, sometimes their partners can get in on that with them and kind of like consider them selfish lovers, like as if the guy has an option to last longer and chooses not to.
Right.
And, I think that there's something sexist inherent in this diagnosis, because if a woman were to ejaculate fast or have an orgasm fast, people would really applaud that. Wow, she was really very sexual, and they would admire it. But there's no admiring going on when guys do this.
Yeah. I wrote about this. I know you think that this is one of your things, but I think it's one of my things. I wrote about this in my last book that came out, I forget, it's a lot of years now, 10 plus years ago, more than 10 years ago. And I called it sexist. And the scenario I wrote about in my book is, imagine a man and a woman in a car.
Okay.
Right?
Yeah.
They're making out, and the guy hasn't even been touched, but he comes in his pants. Right?
Uh-huh.
Shame. I mean, they've made movies about this, right? Like funny, where it's supposed to be funny and embarrassing for the guy. On the other hand, imagine it reversed, that the man and the woman are like making out, they're kissing in the car, and the woman has a crashing orgasm, right? Mm-hmm. Bone shuddering, shaking. And what would we say? We would say about that, first of all, the guy would feel like $1 million, right? That he's got it. He's got the magic and whatever. And we would say she is so responsive sexually.
That's right. We would say that. And it's interesting that women don't have that experience of PE and feel like $1 million. Like, wow, I'm so hot. My guy can't.
Exactly. I turn him on so much. He can't even stand it. He can't take it because he's so excited by me.
Right.
Yeah. And instead we said, put this on the guy. He said, you got a problem.
Yeah. Why are you so selfish?
Yeah. And the weird thing about sex is that there's this, again, in the movies, people have, especially when the lead male and the lead female, assuming they're straight, they have this coming together, this love affair. Well, you always see that starts in the evening, and like they're finished like as dawn breaks, right? Like it's gone on for 6 hours, 8 hours. And for most people who are in a relationship, that's crazy. You can't do that. People have to sleep. They have to function.
They have to eat.
And truthfully, if we even shorten it, like 6 to 8 hours is like, that's the end of that's an extreme. But when sex goes on too long, especially for couples that know each other and are regular couples, there's a point at which it's taken too long.
Right.
And everybody is just tired of it. Like, let's let it get on. And we actually have a medical term for the guys who can't climax soon enough. We call that delayed ejaculation, or DE. Or even when it really gets bad, we say anorgasmia, like difficulty achieving an orgasm or inability to achieve it. And so it's hard to know what that timing is. Not too short.
Right.
Not too long.
It's a lot of pressure, actually.
A lot of pressure. You got everything it's like the old comedian line, the secret to a good joke is
timing. I don't know. I was thinking timing.
Timing.
Do I have it?
I was trying to wait so it was like became silly. Right?
Oh, okay.
It is timing.
Okay.
All right. So premature ejaculation defined. We're going to talk about. I happen to have right here, an article about this. Actually, let me just introduce the article.
Okay.
It's got a long title: Efficacy and Safety of Pharmacological Treatments in Patients with Premature Ejaculation. I won't read the rest of it. First author, his last name is Raisi, R-A-I-S-I, from Tehran. And this is published in the Journal of Sexual Medicine this year in 2025. And they looked at different pharmacological treatments, medical treatments for this, about what worked, what didn't work. And they looked at all the different studies that have looked at these. So they call it a systematic review. And as a matter of fact, this is a review of systematic reviews. Anyway, so that's what we're going to be talking about.
Which is important because, guys want some help. And even if pills, which we're going to be discussing, don't add that much time for them, generally, if they get an extra 60 seconds or 2 minutes, they're pleased with that. Because, that might double what they can do. So
yeah. Let's talk for a second, Dr. Brandon, if you don't mind.
Yes.
About what defines premature ejaculation. And to my mind, it's a little bit like art versus pornography. Like, you know it when you see it.
Okay. All right.
Like whether it's pornographic, it's in the eye of the beholder.
Right. Yeah.
But that's not okay for doctors who like to categorize, codify, right?
Right.
They make rules.
Right.
And so the traditional amount of time when and they use amazing terminology, right? So the key abbreviation is IELT. IELT. Do you know what that is?
Yes.
I'm going to say intravaginal ejaculatory latency latency time, IELT. In other words, how long after the penis goes into vagina does it take before the guy comes?
Right.
And traditionally it was less than a minute. And I think the psychology Bible for diagnosis or the psychiatry one, the DSM-5, identifies it less than 60 seconds a minute.
Yeah, that's brutal.
Yeah. The Sexual Medicine Society of North America, which is sort of my home organization, if you will, it says it's about 2 minutes or less. There are people who come in seconds, and actually when it's severe, the penis doesn't even get inside, but it happens quickly. Now, to me, the reason I say that it's like art, what do you think of those times, by the way? Reasonable?
Yeah, I mean, I tend to tell guys, 20% of men ejaculate within 3 minutes of entry. And if you're in that 20% within 3 minutes, I think that personally, I would classify them as PE.
My take on this is that it's there's a part of this that is so subjective isn't the right word, but it's kind of it's subjective to the couple, if you can be subjective in that way, right? So imagine a scenario where a man climaxes within, let's say, 2 minutes, but the woman climaxes together. Does he have premature ejaculation? No. Everybody's happy.
Right.
Right?
But therein lies the problem. So the women who do orgasm during thrusting tend to need like 15 minutes. And so...
on average.
Right.
Right.
So when they're with a guy who even does 5, which is pretty typical for guys, right? There's a real mathematical problem.
Yeah. I don't know if I've told this story on the podcast before, but if I have, I'm going to tell it again. So this kind of, again, I'm making it subjective, but maybe it has to do with circumstances, situational thing. So I remember seeing a gentleman for premature ejaculation. He walked in and he says, I have premature ejaculation. And as we spoke, I said, well, how long does it take before you come? He said, I'd guess about 5 minutes. He'd been married before. I said, how long did it take with your first wife? For which there had been, and was there a problem? There was no problem with his first wife. I said, how long do you think you lasted with your first wife? He goes, probably about 5 minutes. And the difference was that his first wife was fine, but his new wife or newer wife she was dissatisfied.
Yeah.
That defined their problem as him having PE, but I don't think technically it actually would mean that he had PE, because 5 minutes isn't that bad for, it doesn't meet the criteria. It's not that short a period of time. But she needed more time, which is common. Women, on average, need more time than men do. They need more stimulation. And so that was a problem for them in their relationship. But what that story pointed out to me is that, first of all, that's a common experience. It doesn't mean it's a medical condition, right? Now, he still might enjoy having more control so that he could last longer. But the fact that the man comes more quickly than the woman doesn't mean that it's PE.
Right. There you go.
There you go. Okay. So, but the experience for men when they have this is that they don't have control over their ability of when to ejaculate. So it happens, they don't want it to happen. Like normally ejaculation is a cause for celebration.
Right.
Or orgasm, right? Like the fireworks go off. And for the men who have this or have a situation where they feel like their partner is going to be unhappy, dissatisfied, disappointed, for them it is a huge disappointment. It's like, oh no. Instead of, oh yeah, it's like, oh no.
Yeah.
All right. I'm going to keep going. All right. So there are a couple of different medications that you can use, and by and large, they work.
Yeah. Isn't that great?
Yeah. So we have, up for discussion, are the PDE5 inhibitors, phosphodiesterase type 5 inhibitors like Viagra and Cialis, or their generics are sildenafil and tadalafil. Another category is topical anesthetics. People actually use these things. They can come as a spray or a cream, and you basically desensitize the penis. Then there's tramadol, which is really like a pain medication that's been found to have some efficacy here. There are SSRIs, the selective serotonin reuptake inhibitors, basically antidepressants. That is what their normal use is for, but they have a side effect, which is can make it hard to have an orgasm.
Right.
And what's very clever is that somebody figured out we could use the side effect.
Right. And sometimes PRN, meaning like you take it before sex. You don't even have to take the medicine every day to have it be effective, which is really fascinating that the side effect is so quick.
Yeah. And therapeutic. And then there's another one, which is tricyclic antidepressants. We're not going to talk about that much because they don't work as much, but those are things like amitriptyline. Yeah. So you've seen this article. And one was best. Do you remember which one was best? I don't know.
Dapoxetine? Was it dapoxetine?
Well, of those classes, it was actually the anesthetics.
Oh, okay.
So the anesthetics increase the latency time, which is the time until ejaculation. Now, this isn't total time. This is the increase was over 3 minutes.
That's a lot. But doesn't that interfere with pleasure too?
Yeah, well, to a certain extent, yeah.
So that's kind of a bummer.
Right. So the guy isn't feeling much. So when I talk in the office, so I've done a lot of this work when the guys come see me, they want something. And so they don't care about how much they feel.
Yeah, they just want it to last longer.
Just want it to last longer.
Yeah.
It's all in their mind is about, for good or for bad, it's about performance.
And so generally, if they apply that and wait long enough, it's not going to wear off on the woman and numb her too, right?
Well, that's always been a concern, right? Yeah. So you have to rub it in well. You give it a little bit of time to sort of dry up, if you will, and then it works.
And how much time is a little bit of time? Like,
I think a couple minutes is plenty. But what's interesting is, so the concern is that the woman won't feel much. But remember, the penis is going inside the vagina. And the vaginal wall actually has a lot more surface area than the penis does, right? It surrounds the whole thing and has folds and all that. And, what most of the women need some stimulation of the clitoris, either direct or indirect, in order to have an orgasm. So, in theory, she could feel less if
at the entrance, at least.
Yeah.
Right? At the entrance of her vagina, that's where the nerve endings really are for pleasure.
But you know what? I don't remember. I'm sure it's happened, and usually I'm seeing the guys and not their partners who are coming in on the whole. So I don't remember hearing the guys come back and say that's a problem for my girlfriend or my wife. Have you?
No, but I haven't worked with a lot of guys who've used it.
So we sold a product in the office. There's like a spray, and you could adjust how many, depending how much you needed, you could adjust how many squirts of the spray that you used. It's pretty effective. It's pretty good and easy, and very little in the way of side effects. So that was good.
Okay.
Second, what came in second place?
Well, dapoxetine?
So that's one of the SSRIs. Yeah, and SSRIs work.
Yeah.
The one that's been used most traditionally is Paxil, which paroxetine.
Okay.
But the SSRIs have some side effects too, and they can actually make it so guys have make it difficult to have any orgasm. People can feel weird, can affect their mood.
But they could take a smaller dose then.
So it tends to be a small dose.
Yeah.
And you're right. So the traditional route is they take it every day. But the guys who respond well can and should try to just do it as needed. So you take it sometime before, I'd say a couple of hours before you plan to try and have sex. Yeah. Then came the PD5 inhibitors. This is interesting to me. So when I first heard of colleagues, so I've been doing this a long time. So I've been in the sexual medicine world from before there was Viagra.
Yeah.
Right? Viagra came out in 1998. I started in 1988. And all people used Viagra for the first many years was really just erectile dysfunction. Cialis came along 2 years later, around 2000.
I remember, I didn't know you then, and you wrote that book, The Viagra Myth.
Yeah.
And I remember thinking, there's no myth to Viagra. I mean, that's the dumbest book. I'm like, this stuff works.
Yeah.
That's what I thought.
Yeah.
Well, I didn't read it.
Yeah, thanks. You probably thought that author was an idiot.
I did. I'm like, that guy's just trying to sell books. He's just trying to make money.
Yeah. So I wasn't trying to say that the pills didn't work. That book, if I may, I think it's a pretty good book.
Yeah.
That book
I never have read it.
You never read it?
I never read
I don't know if you should be making this confession on here. In case viewers, listeners don't know, this woman is very near and dear to me. We have a very close relationship.
Right. It's okay. It's okay. Because I think I've learned what you say in the book anyway.
I think you should read the book.
Okay.
I think you might get something out of it.
Very, very likely.
But if I may, it was an amazing moment in time where it was written 5 years after the introduction of Viagra. So what was that? 1998, 2003. And it was really about the mythology around Viagra. There had always been, men had been having trouble with erections since time immemorial, and people used to use rhinoceros horn and all these like Asian therapies and herbal things, and there was all this stuff, and none of which work, of course. And so this was the first real treatment for something, and it was a lot of patient stories about what people thought Viagra would do for them. So, for example, it wasn't that Viagra doesn't work. That wasn't the myth part. The myth was about the whole big thing around Viagra. Guys thought if they took Viagra, their relationships would be amazing.
I see.
Right?
Yeah.
And of course, if you're an ass to your partner, you having
it doesn't matter how much Viagra you take.
It doesn't matter how much firmer your erection is, right? And, or the guys would take it because their wives didn't want to have sex with them. And just because they had a better erection didn't mean that. So the guys brought a lot around this to the idea of Viagra and what it would mean for them.
I see.
And it really had to do with the penocentricity of men, if I may.
The penocentricity.
Yeah.
Okay.
Yeah. So, So when I first heard about people using PD5 inhibitors to help with premature ejaculation, I said, that doesn't make any sense.
I just thought it was so that they could get hard quicker again if they had an orgasm.
Right. So that was part of the explanation. But you want to know something? When they do the studies, that intravaginal ejaculatory latency time, the time it takes to come, was increased. These are placebo-controlled studies by almost 3 minutes.
That's incredible.
It's incredible.
It is incredible. Now, why would that possibly be?
Well, it's all supposition, and
Wow.
And I think that part of what happens is that the quick ejaculation thing is at least partly the result of anxiety. The guys are afraid they're going to come quickly. The more that they get a little panicked about it, the more likely it comes. And so, you would think that a placebo might have a good placebo effect.
Yes, you would.
Yeah, but guys who take these medicines really work. Like
so they'd notice an erection change. They would notice they were getting hard quicker, which they wouldn't notice with a placebo. So they are like, wow, the medicine's working.
Yeah.
And it calms them down. That makes total sense.
And often they get side effects even before the erection happens, that they know something's happening. They get flushed. They feel warm in the face. They may get a headache.
I see.
Yeah. It's funny. In this study, they talk a lot about the side effects that go along with each of these treatments. They're trying to balance the benefits and the risks. And some of this, I think, is silly in my opinion. Of course, we care about risks, but the risks from the Viagra and Cialis medicines are what we call nuisance effects, right? So some people can get a headache, some people can get stuffed nose, their face may get red, or their neck. They can get heartburn, GERD, but almost all these guys who are getting good response would in a heartbeat trade those side effects or those risks for the benefit that they're getting. Yeah.
Good.
So there you go. So the important thing for me was all of them worked to a certain extent. The best were the topical anesthetics, followed by the SSRIs, but even the PD5 inhibitors, which are extremely safe, work.
So, and what I would add to that is when a guy comes to my office with this issue, and let's say he doesn't want to, I always encourage them to see a urologist around these kinds of options.
Yeah.
But let's say he doesn't want to go that route, or he's got to wait 2 months to get in to see his urologist, whatever else. So something that can be very helpful for them is to get a sex toy that is, they're made for men. They've been around a while. They used to be called fleshlights because they look like flashlights, but there's many of them now. Fleshlight. They used to be called that. That was because there was only one.
Yeah.
But now there are many. You can get them on Amazon.com or whatever. And so they're like cones, and you put your penis inside. They feel like the inside of a body, and you can practice masturbating with it. It feels like a real person, and kind of learn more self-control with that device. And so guys can start without any lube at all. If they ejaculate really quickly, they can use no lube, learn control without lube, then start using lube. It tends to make that device feel even better, and then practice with lube, so that they're sort of more aware of their body when they join their partner. And it can take some time. This isn't just like one or two.
It's like a retraining.
It is a retraining, and it can be very effective. And I saw a study recently where they compared guys using this device with PE, and then also it was supplemented with one of these SSRIs.
Yeah.
And they had a great result when it was paired together.
Yeah.
So
great.
Even better. So this study didn't look at that, but if you're going to take one of these medicines, which I would absolutely encourage guys to do, I mean, that would be very helpful. But if they take the time also to learn their body a little better with these devices, masturbate more with those devices, I think it will be that much more helpful. And I always tell people when they have a concern about their erections or having an orgasm too fast or not fast enough or whatever else, that talk to your partner if you're in a relationship and develop a plan for when, this thing happens, whatever it is that you're dreading, because it's going to happen, because it happens to everybody. So there will be times when it's going to go wrong, even if you've practiced and you've gotten where you want to go or whatever else, because shit happens, right? And bodies don't always function the way you want them to. So just have a plan with your partner. So if you find that you had an ejaculation too quickly, then bring out some sex toys and play with your partner, or do some agreed upon thing. So maybe it's you lay together and massage each other. It really doesn't matter if it's sexual or not. But what you don't want to do is get pissed off, not talk, walk out of the room, like make a bigger deal out of this, because it's going to happen. So don't get dramatic.
Who shouldn't walk out of there?
Nobody.
The guy or the partner?
Anybody. Like, just know that this stuff happens.
Do you do any coaching for the women?
Oh, often, because with sex therapy, a partner's response doesn't matter who's got the concern, but the partner's response has a lot to do with how that person
Absolutely.
Succeeds in sex therapy or not.
Absolutely.
So yeah, it's often very much a couple's issue.
Yeah.
So
yeah. For those of you listening who are concerned, there's the bottom line is there's a lot you can do. And the success rate for this with one thing or another can be pretty high. Mm-hmm. And frankly, and even if it's not, even if we can't increase that IELT, mm-hmm. It doesn't mean that you can't have great sex.
Yeah.
Right. And everybody can still have a good time.
Right.
Because would you agree?
I totally agree, because there's so much more to sex than thrusting.
Yeah.
I mean, that's just what's true. So
yeah, I see some of this training issue, that when guys are younger, when they, almost all guys their first sexual experience isn't sex, it's masturbation.
Yeah.
Right. And so, and it's often something shameful, or they're hiding from their parents or something like that. And there's actually an advantage, if you will, to getting it over as quickly as you can. Mm-hmm. Right. And so then all of a sudden, one day, years later, maybe
now you're supposed to last really long.
Right. Like,
yeah.
What the hell? Like the whole script has changed.
Right.
So so some of this has to do with retraining, and I think that the fleshlight example that you give with the guys learning how to there's sort of a point of no return. Yeah.
Ejaculatory inevitability.
Inevitability. I love that.
Yeah.
And the guys can learn when that is approaching, but they're not quite there. Mm-hmm. And then it means they need to back off.
Right. Slow down, move differently. And they can learn that with these toys. All you have to do is go on Amazon.com and type in sex toys for men. Many things will show up that you've never seen before.
Yeah.
So.
Anything else you want to say?
No, I think that covers it.
Dr. Brandon, I think we covered it.
Okay.
Yeah. And, so thank you so much for doing this with me.
But
it was a pleasure. Oh. And it wasn't too quick and it wasn't too long.
That's right. It was perfect timing.
It was just perfect timing. So this ends another episode of The Sex Doctors. You can find us at thesexdoctorspodcast.com. So you can see all our content. And if you really don't want to miss anything that we put out, what should they do, Dr.?
They should subscribe. They could also go, talk to us through our website, thesexdoctorspodcast.com. But subscribe.
Subscribe.
For sure.
Okay.
All right.
See you guys another time. Bye-bye.
Bye.